All right. All right. Welcome, everybody. Thanks for being here today at the Older Vermonters Caucus. I just wanted to start off with I have a resolution that I'm working on for recognizing February 22nd as Age Strong Vermont Day. I would really appreciate it if you reach out to your legislators and ask them to be an additional sponsor on the resolution. I've gotten quite a few sponsors, but we got plenty of room for more. So if you happen to have an opportunity to talk to your legislator or run into any other legislator, they can always track me down, and I would be very thankful. I'm going to try to turn this thing in. I'd like to do it by the end of the week, maybe first part of next week. I don't know. So yeah, please have anybody track me down that would like to sign on to this, and I will make a copy available. Meg, you have a copy, I believe, and then I think many of others have provided some input on it, which is thank you so much. I know I got Mary here who's been involved and others from AARP. So thank you. I think this is a good way to recognize the work that we've been doing over the past years on a comprehensive plan for older Vermonters. So I just want to make sure that my colleagues have access to it and think about it as we move through the legislative process on other bills that affect older Vermonters. So I don't know if anyone has any thing they would like to add or anything they want to bring up before we get started today. Please let me know something that you've been following a bill or an issue in the legislative process. Steve,
Yeah, now
raise your hand.
this resolution that you are working on, this is a joint resolution, so I contact my senators also.
It would be wonderful if a senator wanted to put it in. The bill that I have, is just in the House.
Okay, and do you have a number yet? Because you haven't put
Well,
it.
it won't have a number because it's a resolution. It's what I've done is scheduled it to be read on the floor on February 22nd, and then
Gotcha.
hopefully you all show up, and then I'll stand up and introduce you. We'll all clap. But I know that any senator can do that as well. So talk to your senator. I'll give him a copy.
Yeah, if you email me a copy, I'll contact Peter and Jonathan and et cetera, et cetera.
Perfect. I will send out a copy to everybody on the mailing list.
Thank you.
And also, if you're not receiving the email list, I have really no control over it. It's through Ledge Council. I send them a Excel spreadsheet when people fill out the form and they update it. I don't have access to the mailing list, except that I keep sending them updated email lists, and hopefully everybody eventually gets on it, and appreciate anybody who's sharing it with their friends to be able to access our meetings here. So, yeah, go ahead, Mary.
I just wanted to follow up to what Steve mentioned, follow up to part of what Steve mentioned, which is that we do want to tie Age Strong Vermont to our legislative advocacy for certain bills, because we're already hopefully accomplishing many of those objectives and strategies. So maybe I'm just also calling out to Meg. Maybe we can talk to people about that in advance of February 22nd, so we can, prep people for those kinds of conversations as well.
Yeah, there'll be a registration form. Hopefully we'll have it by the caucus next week, and we can send it out for participation in that day, which you can share widely. And if you register, that will help Mary and other advocates and I know who's coming, and we can support you in trying to meet your legislator, making sure that you have a name tag that matches, and helping us to really advance that. And I'm going to put the link for for anyone who's not getting an email about this, I'm going to put the link for that form in the chat as well. And I will keep track of those and keep sending them to Representative Noyes, and hopefully our group will continue to grow.
Great. Thank you, Meg. Appreciate that. All right. Any other announcements? All right. Well, today we have an update from our long-term care ombudsman, so I'm going to turn it over to her. Kaylee, thank you for being here today.
Thank you for having me. Would you like me to share my screen or would it work
Yeah.
better if I just?
We can make you, no, do you want to do that? I can make you a co-host, no problem at all. We push the right buttons in the right order.
A reminder, you don't have to make her a co-host. You just have to go to your security badge and enable screen sharing for all participants.
Okay.
Oh, man.
I found that one first, so that's what I'll do. There you go. Good tip, though. Thank you.
Hello, I am Kylie Kuiper. I am the State Long-Term Care Ombudsman from the Vermont Ombudsman Program at Vermont Legal Aid. I'm here to talk a little bit about our project. The federal government established long-term care ombudsman programs in every state. Oops, sorry. Back in the 70s in response to concerns about conditions in nursing facilities. The Vermont program was started in 1975. In the beginning, we advocated for residents of nursing facilities, but now we advocate for individuals who live in any licensed long-term care facility, which includes assisted living and residential care facilities. And we also advocate for individuals who receive long-term care in their home through the Medicaid Choices for Care program. As you can imagine, our clients are some of the most vulnerable and isolated members of our communities, but they still deserve dignity, privacy, and the ability to direct their lifestyle and care. So as I discussed, we help people who are in licensed long-term care facilities or on the Choices for Care program. The bulk of our work addresses complaints about, the complaints are by residents of facilities or their family and friends, or sometimes we get complaints from staff and facilities about needs of their residents. These complaints are against long-term care providers, long-term care facilities, public agencies, health and social service agencies, and legal representatives. And they are about issues that adversely affect the health, safety, welfare, or rights of individuals who are receiving long-term care. In addition to helping to resolve specific complaints, we also monitor long-term care facilities by visiting them and checking on conditions. We educate individual residents and their families on the residents' rights. We also educate staff and providers about residents' rights and good care practices. And we work to improve the long-term care system by identifying systemic issues and advocating for laws and policies that strengthen resident rights, improve care, and lead to better quality of life. Our role is to provide person-centered advocacy, which means that we always take direction from the person receiving long-term care, and we work to empower individuals to be able to have control over their life and make decisions about how they want to live their life. Our current team consists of 6 local long-term care ombudsmen. 5 of the ombudsmen cover specific areas of the state, and 1 helps with our statewide hotline. And then I'm the director of the project. Just wanted to share a few of the statistics from fiscal year 2023. And I also wanted to note that if you want to see our full report, it's on the General Assembly's website. In fiscal year 2023, which was October 1st, 2022 to September 30th, 2023, we addressed 553 complaints on behalf of long-term care recipients, and we resolved 92% of those complaints to the satisfaction of the care recipient. The top complaints had to do with care quality and involuntary facility discharge. I suspect it's because of, at least in part due to the staffing shortage, but we anecdotally feel like we're seeing more and more issues with care quality that we didn't used to see 10 years ago, especially things like pressure sores becoming an issue a lot more often when facilities used to really strive to be on top of those types of issues. We also are seeing increasing involuntary discharge or facility evictions. These are the people that are being discharged are often the people that need the most care, the people with the highest physical and mental health care needs, and are therefore the most vulnerable to being discharged and have the hardest time finding alternative placement that can take care of their needs. In addition to working on complaints, we completed over 500 visits to long-term care facilities. We completed over 400 instances of advice and information to individuals and over 200 instances of training or consultation with facility staff. This is just some general statistics on the types of complaints we received in fiscal year 2023. And I just wanted to note that 30%, slightly over 30% had to do with care. Also included some statistics based on counties. This is just for the complaints that came out of facilities. It does not include the choices for care or community clients. Finally, I wanted to give some stories from this should have said fiscal year 2023, to sort of illustrate the type of work we do. So the first one is a facility eviction, also known as an involuntary discharge. We heard from a resident of a residential care facility who suffered from significant mental illness, and he had received an involuntary discharge notice. He was afraid that he was going to be forced into homelessness if he was evicted from the facility. The facility director initiated the discharge because she felt he was doing things that were not safe, like using the stairs unassisted. He was not bathing regularly, and she thought he was asking for too much help. She also thought his episodes of incontinence were intentional. He reached out to us and said that he felt that he was receiving conflicting information from facility staff about when they wanted him to be independent versus when they wanted him to ask for help. He also complained that staff were demeaning towards him. The local ombudsman worked with the residential facility staff to try to improve communication. The staff realized that they needed to change their approach to the resident. The staff were instructed to help the resident to use the elevator with his walker when he requested assistance. And the resident agreed to use a walker when he was walking in the hallways and to alert staff when he wanted to use the stairs so he could get some help. The staff member that was rude was instructed on treating residents with dignity and respect. The facility worked to get the resident disposable briefs that worked for his sensitive skin, and he started seeing a doctor about his incontinence care. The resident shared that he needed assistance using the shower and requested a male staff person who he felt safe getting assistance from. With these improvements in place, the facility rescinded the involuntary discharge notice. The second case I wanted to highlight involves self-determination. We worked with a 78-year-old gentleman who was in a fairly common situation where he had been living happily independently at home and then ended up in a rehab facility after a fall. The rehab facility did not feel that it was appropriate that he could safely return home due to mild cognitive decline, and they tried to initiate getting a guardianship over him so they could keep him from returning home. He reached out to the local ombudsman for help. He had supportive housing, case management, and family support already. The ombudsman helped with discharge planning, and the family became the man's durable power of attorney so he could get some help with managing his finances. He returned home where he felt happy and safe with services. Finally, I wanted to highlight a situation where we collaborated with Vermont Legal Aid's Elder Law Project. We heard from a resident who had experienced mild cognitive decline, so she hired an agency to assist her with her finances. She reached out to a local ombudsman because of the agency's problematic behavior. The employees were overly controlling and disrespectful. They did not involve her in decision-making about her finances or share the status of her resources. She described feeling fearful of them. They insisted on attending medical appointments with her, which she found unnecessary and humiliating, and they referred to themselves as her guardian to other providers. The local ombudsman referred the client to Vermont's Elder Law Project. That Elder Law Project attorney obtained documents from this agency and confirmed that they had power of attorney, but not guardianship over her. Under the client's direction, the ELP attorney dissolved the guardianship. And together with the ombudsman, they worked to secure an alternative person who the resident was comfortable taking care of her finances. They also assisted her in getting all of the records that were held by the agency that had been her power of attorney. And they supported her in informing the administrator of her facility about the problems with the agency. The client was relieved to have regained control over her life, and the administrator of the facility was grateful to be informed that this agency was not a good referral to others. Lastly, I wanted to talk a little bit about a current legislative proposal that our program has regarding the personal needs allowance. The personal needs allowance, or P&A, applies to nursing home residents who are on long-term care Medicaid. The P&A is the amount of their monthly income that they are allowed to keep to pay for personal needs. This includes, but is not limited to, their clothing, glasses, phones, computers, entertainment, gifts, and pet supplies. Currently, individuals in Vermont are able to keep $79.93 of their income, and all of the rest per month, and all of the rest of their money goes to their care. This is the number as of January 2024. There are no automatic increases to this amount to account for inflation, and it has only been increased twice since 2001. It takes legislative action to increase the amount. So we are proposing that Vermont implement an automatic cost of living increase to the P&A so it can keep up with inflation, and there does not have to be ongoing legislative action to make this happen. That's the end of my presentation, but I can take questions if there's any questions from the group.
I have one.
Sure.
Is there a bill for the P&A?
There is not.
Okay.
Right now.
Do you think that would help, or?
Yes, and that's something that we would like to propose.
Good to know.
Yeah, and we've proposed it in the past, but we haven't officially.
Well, that's what I thought. There had been
There was a bill in the past, for
There was
sure.
a bill in the past.
Do you want to stop sharing? I
Sure.
see we got a
Yes.
couple of hands up on the screen, but I'd like to stay on this P&A for a little bit and appreciate you pointing that out, because that is something that we dealt with in the Human Services Committee a few years ago and recommended that it be increased to the Appropriations Committee in our budget letter. I think we need to, keep talking about this and keep it in the forefront. And I think your idea of making it a annual inflator tied to inflation is a good idea, and it will keep us from having to keep revisiting this when it becomes out of line with what people in long-term care need for services and access to their money. So we can definitely talk. Obviously, we can't put a bill in now. It's kind of past that time. But, I think that should be something that we could talk about as we get closer to writing a budget letter from the Human Services Committee. So I appreciate you bringing that up today. Let's go. We got a couple questions. I see some hands up here. I don't know whose hands went up first, but what do you think? Steve, you want to go?
Thank you. I think Matthew's hand was up first.
All right, we'll send Matthew first then.
Yes, thank you, everyone. My question is, how will that in compute for senior citizens on SSI, Social Security benefits? How will that, because that's a big question about the whole finance part of that, which, it's a tit and tat, as we know in Vermont, someone's got to pay for something. Will that affect senior citizens on SSI when during that, tied into that program, because that's one big issue that I see across is, it's something, if a program's getting paid for, it's getting paid for by something or someone or
Right.
some program. And I'm wondering if that is going to affect it. Senior citizens, veterans, individuals with disability that are on SSI, will that affect that portion of the program? Thank you.
No, I don't believe it will. It's basically allowing individuals who are in long-term care access to money so that they can buy clothing and get haircuts or any other thing they need money for. It's not it wouldn't affect anybody's Social Security, but it is their money, right? It is their Social Security money. Is that where it comes through, or does it come through the general fund? I'm not sure on that,
So
where the funding source for the personal needs allowance comes from.
So yeah, it's a little complicated in that it allows them to keep more of their own income.
Correct.
It could come from different sources, but in allowing them to keep more of their income and allowing the facility to have the same amount of money, I believe for most people, that's a Medicaid increase, long-term care Medicaid
Yes.
fund increase.
So it would be a portion of so a portion would be general fund dollars that would match the Medicaid dollars.
I believe.
I think that's right. Yes. So we would need to allocate more general fund dollars that I can guarantee you are in short supply this year.
But also compared to the entire Medicaid budget,
It's a very small amount.
Yeah.
For sure. Yes. Anyone else have anything they would like to add on the personal needs allowance before we move on? Or maybe Steve, that was part of your question. Okay, anyone, Steve? Yeah, go ahead, Representative.
Then it strikes me that if there has been inefficient revising of that amount since 2001, that it should be retroactive to a certain point if you want to add costs of living rates. It shouldn't just begin in 2024. It's a recommendation.
Yeah,
If $79 when you talk about glasses, telephone,
mm-hmm.
clothing, barely gets you through
It does.
a week.
And I know that do you remember what the line item was for even at the level it's at now in the budget? I'm not sure. However, I believe next week we will have we will be talking about the Dale budget, and maybe that's something we can kind of key in on next week and figure out what that line item is currently and what the increased costs would be to increase it. Retroactively, if we were to go back to the last increase, which was I think it was 4 years ago, 3 or 4 years ago.
So the 79 is as of January 2024.
Oh, okay. So that took effect recently.
But it was 73 for a few years before that, and then it was 35.
I remember it was really low.
But those changes both sort of were decided right before I took this position. So I don't have a history with that discussion and how those numbers were landed upon. I know currently the maximum possible is 200 set by the federal government. And there is at least Alaska has 200. There's a few states that have close to that. So it could be quite a bit higher.
Mhm.
Thank you.
We have a question in the chat that I just happened to see. It says, do you provide services to people currently in the hospital awaiting long-term care placements? The wait has become very long for some people.
That is a huge issue, and generally, our role is clear if someone was in a facility, is in a hospital, and wants to return to the facility, and the facility is telling them they can't return, that's an involuntary discharge, and that's definitely something that we help with. If somebody is on the Choices for Care program and wants to receive services in the community and is being denied services, we can sometimes help with that. When it just comes to finding a place in a facility for someone who isn't returning to a facility, that's just a very tricky situation right now in Vermont. You're welcome to reach out to us, but we aren't a placement agency, and it's a major issue. I believe there's some pilot programs through the Money Follows a Person program right now to try to help with those types of situations, but they are very tricky.
Mm-hmm. And so where do you see a lot of the involuntary discharges? Where do those individuals end up? Do you track that at all if there is no resolution? I mean, it was great to hear that you were able to work with someone so that they were able to stay housed and not in an ER or a hospital where it's really not the appropriate place for someone to be aging in Vermont.
We don't track everybody who's been discharged, and I'm sure we don't hear from everybody either. We only hear from people who complain to us. Our information is supposed to be on discharge notices, but we don't know what we don't know. But facilities aren't supposed to discharge people if they don't have a safe placement. So that's another thing that we would argue in involuntary discharge, that maybe they haven't been paying and there isn't an argument. Otherwise, there can't be a payment plan worked out, but we try to make sure that the facility doesn't discharge them before they found a safe place to put them. And if they end up in if they end up in another facility, we hear from them again, but we don't officially track everybody. And I think my biggest concern is people who end up back in the community because either that's really, really where they want to be, or because they couldn't find another facility to find them or that would take them. And there is so few community supports right now, especially for new people into the system, that they can end up in very unsafe situations. And we also hear from lots of people who end up out of state, which is really sad. People want to stay in their community. They want to be close to their family and friends and everything that they've known. And Vermont doesn't have the capacity to keep them.
Mm-hmm. Yeah, and I know that some involuntary discharge is directly related to an individual's or to the facility's ability to care for that person. Especially with Alzheimer's or dementia, where they just don't have the capacity. And, that's something that I think we're working on to try to figure out how we adequately fund beds for individuals who need a higher level of care, because last I heard, there was like 130 people in in hospitals that don't have access to long-term care because of just their ability to find someone who can provide that level of care.
Yes, yeah, and it's a big burden and expense on hospitals, and it's terrible for the people that are experiencing that are living out of the hospitals. Right. And we really need to increase our ability for people to remain at home, because that's what so many people want.
Yep. Good. Meg, I see your hand up here.
Yes, thank you. This conversation has been top of mind as I've been listening to the presentations on the governor's budget and the governor's budget address, and been at the State House for Homelessness Awareness Day. And I would like, I'm trying to looking at how we're advancing Age Strong Vermont and the priorities in there of having more community-based dementia-friendly housing. And I'm really thinking about how we can talk about older Vermonters with dementia who are in the hospital right now as part of that number of homeless Vermonters. They do not have a place to live that's safe for them, that's appropriate for them in the state of Vermont. And so I'm really trying to think about how we can wrap that in, because the funds that we're using to keep them in the hospital are great, and we could do other things with those funds, and the placement is not good for them, and it's not good for our hospital system. So just throwing that out there. I can't see who's in the legislative room, but I really like to try to continue to brainstorm about how we can help you make sure that the older Vermonters are often invisible. And I feel like the folks that are in the hospital waiting placements are like double invisible. How can we raise their visibility as some of the people that are also looking for appropriate, age-appropriate, community-based housing in our state? And I don't know, Kylie, if you have thoughts about that being someone that would try and help them find the right spot, or if it's just something for folks to just be thinking about as housing is on everybody's mind this legislative session, and there is a lot of need there. Thank you.
Meg, you raised a really good point. We do need to think about older Vermonters that are in hospitals as in the context of the housing discussions that we're having right now in my committee, because they technically are homeless. And so I appreciate you bringing that up.
I don't think I have anything to add at this point. But I
think that comes down to money.
That's a really good point.
Yeah.
Yeah, can I just I don't know that, we all are relying on the data that we're provided by DCF. And so I'm not sure how that's being tracked. So
The
that,
number of individuals in a hospital.
right. So if you're on SSI and, or SSD, are you being tracked for that? Are you being tracked if you're not on SSD or SSI
Right.
it's like part of it is interpreting and understanding the data that we use,
Sure.
that everyone is using in the
Yeah.
state.
No, good point. And I've reached out to the Vermont Hospital Association for data on how many individuals are waiting for access to skilled nursing facilities who are in the hospital. And they have, it seems like she's tracking that number because they were able to get it back to me pretty quickly.
Are they reporting it though to that's,
I don't know if anyone's
Joint
asking.
Fiscal and AHS and where those official reports are coming from?
Don't know.
Yeah.
Good question. Yep. Steve, I tried to call on you earlier. I'm not ignoring you.
My apologies. You know what happens? You're on one meeting and then the phone rings something else, etc. I am disturbed by what our first guest was reporting about involuntary discharges, and then investigating and finding that a staff member had to be trained on how to treat clients. An employee wasn't adequately trained. And I'm just shocked by this. And some of the things you were describing about behavior by these facilities or individuals seems to me, in some cases, are raising issues of law enforcement. I'm hearing basically about assault is what I'm hearing. I know as an ombudsperson, you don't usually get involved in that sort of thing. You're trying to be a neutral and problem solve, and I certainly appreciate that. But anyway, that's something that I wanted to mention for what it's worth. Thank you.
Well, I appreciate that comment, Steve. And I should have clarified our use of the word ombudsman. It is different than you see in other contexts. So I know ombudsman is often considered a neutral party. For long-term care ombudsman, we're advocates for the person receiving care. And if they would like to, we help support them in making complaints to the state survey agency or adult protective services, but we won't submit any complaints without the residents' support on that. We only act at their direction.
The direction of the client is what you're saying.
Correct. The resident long-term care facility. Yep.
So if you encounter a situation which appears to be one where law enforcement or adult protective services might be necessary, do you advise the client that this is a possibility because they may not even be aware of it?
Absolutely. Yeah.
Okay. All right. Thank you very much.
Yeah. You're welcome. Thank you.
And I know Meg and I have had some discussion about making sure that people have access to training who are working with individuals with Alzheimer's and related disorders. So I don't know if you want to say any few words about that, Meg. I don't mean to put you on the spot, but
just to say, like, it's something that we're always working on. That's a big piece of our BOLD funding that we get from the CDC. We have some new programs that we're starting to roll out through the Memory Center to look at for models. I think we mentioned last week the State Dementia Services Coordinators coming on board. And we are continually doing both education programs in the community, as well as working with facilities if they would like to have access to the Alzheimer's. It's called Essentials, free online training, and Vermont Health Connect has modules that are free for Vermonters that are specifically created by our folks at the UVM Memory Center around diagnosing dementia and supporting dementia. So the work is big. It is happening. I will say, if anybody on this call, particularly the advocates, is interested in being a community educator, we need more people who go through our training. It's not difficult and are willing to go out. We support you and plan the meetings and do some of those community education programs. And if there's folks on this call that would like our dementia resource guide, which we just compiled and have printed, I will put a link to that in the chat. And if you want a paper copy, my email's in the beginning of that, and I'd be happy to mail paper copies to you, particularly if you're a provider and you think it would be helpful. Those will be going out to providers' offices in the next couple months with the help of an intern who's working with us and the folks at the UVM Memory Center and the Department of Health. So the work is definitely ongoing, but it's happening.
good, thank you. I'm sure we'll be hearing more about your work at an upcoming caucus meeting, so thanks. Anyone else have any questions, comments, things you're working on? Okay.
I do think Wendy was going to say a few.
Sure. Welcome, Wendy. Thanks for being here today.
Hi, thank you. So I'm Wendy Morgan from Vermont Legal Aid, and I just wanted to let any legislators know that I'm in and out of the State House. If you have constituent services questions, or you need to connect with somebody at Legal Aid, I'm a good point person, or Mike Fisher, who's also in the building. He's in the building more than I am, but we're happy to take questions from you on constituent services needs.
That's great. Yeah, thank you. And I actually have a note taker. I don't know if anyone saw in our meeting announcement that I do have somebody who's helping me out with notes. So we'll make sure that those are included in our minutes, notes from this.
Thank you.
I see a hand up here from Betsy.
Yep, can you hear me?
Yeah.
So just a quick question for you. Would the Callie, would your organization be the right place for somebody or for people that are being involuntary discharged from an independent living facility because they have cognitive decline? Because it's not a long-term care facility, but they're making them go to a long-term care facility before they're ready, shall we say.
I can appreciate your question. We don't work with people who are in independent living. The regulations are different. It's just a different situation, depending on the situation, especially if the person's low income, the Elder Law Project might, Vermont Legal Aid's Elder Law Project might help, or Disability Law Project or Poverty Law Project. But we don't work with people in independent living.
Okay, thank you very much for
You're
clarifying.
welcome. Yeah, it's a good question.
All right. Thanks. Any other questions, comments? Okay. Well, great. I hope next week to have Dale here talking about the budget. Unfortunately, they couldn't make it today due to a scheduling conflict. So thank you for stepping up and filling in last minute while I'm like panicking in committee trying to figure out. So thank you so much. And I look forward to seeing you all next week. Watch for an announcement and we'll have the topic and of course the link. And if you want to add anyone to the mailing list, you can have them fill out that form, and which I'll include also. So just pass that on to them. All right. Thank you, everybody. Have a great day.
Thank you, Dan.
Thank you.